Oh, good morning. Oh, that's brilliant. See, we've got very American in the last 12 months when we've been working with IHI, so we ask you to say good morning. So can I have it again, please? Good morning.
Good morning.
That's better. Now we've got some energy. So, stood on this stage a year ago and was terrified because of what we were going to try and do and the enormity of the task in hand. I have to say, still terrified 12 months on, but I feel we've come an awfully long way. So, what I wanted to do with you now in the next sort of 25 minutes is give you some reflections on what we feel we've achieved in the last 12 months and some reflections on how we've achieved it. And then later on this afternoon, Phil Duncan is going to sort of walk you through how we're going to flex what we've done this year into the next year's activity in the collaborative. Because this is an improvement project that is not fixed. We had a very good model and an idea about how we were going to run this over the 3 years. But as with any improvement work, we have to adjust as we go along. So we've listened, we've watched, we've tested, and therefore we're going to change a little bit what we do next year. But just some ideas about and thoughts about what we've done. So a year on, we're 1 year into our 3-year journey, and then this hopefully will be something that becomes cemented into our everyday life in the way that we work within maternity and neonatal care. And I think we've achieved an awful lot in a year. We've worked with 44 organisations this year, and just out of interest, how many Wave 1 sites are in the room? And how many Wave 2 sites in the room? And Wave 3 sites? Okay, so we've got really good spread, which is super. But these guys for the last 12 months have been just amazing. And I have to say, after our recent third national learning event we had in Manchester, I came away feeling unbelievably humbled and incredibly privileged to be working, because you have done some enormous amount of work in the last 12 months. I think the level of learning has been amazing, and I'll talk a bit more about that in a minute. But I think what I wanted to also highlight at the moment is the support network that we've put in and how valuable we feel that's been and the feedback that we've had about that support. But none of this would have been possible without the 3 improvement managers that have worked within the programme and worked with these 44 organisations. And Katie, Janine and Heather, I think most people in the room, the Wave 1 organisations would say they've been instrumental in their learning and their journey over the last 12 months. And that's been a fascinating way for us to see how we can meld the understanding we have and build that into the way that you've been working. So over the last 12 months, they've done 216 site visits, which is an awful lot of miles. There's been quite a lot of time spent in rather small, pokey hotel rooms and an awful lot of time spent on trains. But for us, it's been absolutely vital that we've been able to go out and meet with you and work with you. I think we had an anticipation that that was going to be somewhere in the region of 6 to 8 visits per trust over the space of the 12 months. And we've certainly managing to keep on track with that. I think there's an opportunity for us to work better and flex the way we support you next year, and Phil will talk a little bit more about that later on this afternoon. But certainly, we spent a lot of time on the road, but the feedback that we've got is that one-to-one support has been really important. But again, these 216 visits don't really give the full story, because on top of that, there's been numerous phone calls, emails, webinars, and lots of telephone conference calling as well. So we've really tried to put a lot of support into the system and reach into the organisations. And most of those organisations have only had 3, 4, 5 people in their local improvement teams. And improvement's a lonely place. It can make you feel very, very vulnerable a lot of the time, and that sense of not feeling that you're moving forward. But I think the support that we've been able to give has been really, really helpful to build that as we've gone along. And then the main sort of focus that we've had as a core group has been this national learning set that we've run over the last 12 months in partnership with the Institute for Health Improvement in the US. And that's been these 9 days that we've spent together as a group. And we started off in Leeds in the middle part of last year, then went to Bristol in September, and then met up again for the final one in Manchester in January. And I found those 9 days fascinating. I think the energy that was in the room from word go was extraordinary. So the amount of pride that everyone had in their own service. So when you went to visit, but certainly when you got people together, they wanted to tell you how wonderful their services were, but they also wanted to tell us how much they wanted to improve those services even further. So the level of ambition was extraordinary. And there was a lot of pushback. So certainly that first meeting we had in Leeds, there was a bit of scepticism in the room. There was a bit of, and that was, a lot of understanding needed to happen about what we were trying to get people to do, because it felt very alien. But as you move through the three different events, and certainly when we got to Manchester, the flavour of the conversations had changed enormously. There was this unbelievable sense of collaboration, people talking and learning from each other actively. We did an exercise called the Capsular Exercise that IHI do, where you have to basically talk about your problem at a table with a group of people, and then you have an opportunity for those people to then discuss your problem themselves when you're not allowed to say anything. And if we'd have tried to do that exercise in Leeds, it would have literally been mayhem. But when we did it in Manchester, everyone sat at the tables, and there was the most amazing amount of active listening going on, support and help. And the collaboration that then went on and sharing of ideas was brilliant to listen to. It's got very dark all of a sudden. And that actually just showed the way that everyone had evolved in their thinking. So as a doctor, my classic approach to problem solving is to grasp a solution and try and chuck it in very quickly. That's what we tend to do as doctors. We're very good at looking for what we think is the right way forward. But that shift that's happened now is that people talk about understanding the question, they develop their thinking, they're very actively talking about testing, and then we move into that solution building afterwards. And that's a real shift. And listening to the way the people were talking in the room in Manchester was a real eye-opener for me. And that's evidenced by the fact that we've taken 206 people in the last 12 months through that 9-day learning set. So 206 people who've now got a really detailed understanding about what quality improvement means. And if you multiply that up and think what we'll have this time next year and the year after that, you've suddenly got a really skilled community of quality improvers. And that's something we've never had in maternity and neonatal health before in this country. There's always been energy, but there hasn't been an understanding and a capability in the way that we've now got. And that's something we really should be very proud of. It's not something that you see in many other systems in healthcare in this country, but certainly across the world. So this is a really fantastic resource. And that's only the home teams, or the away teams as we describe them. When they go back, and the influence those 206 people are now having within their own organisation is much greater. And so that's very much something I think we should be celebrating. And certainly the celebrations have come fast and furious on Twitter. We had some unbelievable feedback, some of which I'm showing you up there from people who've come to these learning sets. And I've been bowled over by the level of enthusiasm we've seen. And in fact, Heart of England yesterday posted a fantastic video, which I almost feel like we paid them to produce, because you couldn't ask for more sort of praise of a collaborative process. So that's been a really lovely thing to see as well, this sort of outpouring of a sense of achievement that we're now getting in the room. And if you'd have asked me 12 months ago, what would I want to see 12 months down the line, it would be this, because this is what you need. Social movement is the way that we make change. Skills are one thing, but when you start building this level of enthusiasm, you will start to see a shift. And around you here, you'll see a number of the posters that we had when we were at the event in Manchester. And these aren't just people talking about what they're doing. In here is a real understanding and a narrative about how they've achieved it. And really seeing the way in which they've tested, the way in which they've developed their thinking, and the metrics and the data that support the actual changes they're starting to see. And so I think that's real evidence that people are happy to share what they're doing in a way that actually I don't think they would have done before. And again, when we were in Manchester, we had a fantastic session where people were asked to talk about what they'd done to other people. And when you listen to the way that they were describing their projects, their understanding of quality improvement is there. It's becoming part of their language. They're becoming fluent in the thinking, because a lot of this is very alien to us. And so my reflection on that is that's a real step forward. That's something that we were really hoping we would see. And in fact, overall, across all of the 44 organisations, we've got now 176 projects up and running. I mean, that's an enormous amount of work that's being undertaken. And we're not just talking about sort of lightweight improvement work here. We're talking about very serious pieces of work that are focusing on very serious and undeniably difficult to tackle problems. So again, this is a huge amount of work that's being undertaken. And then you start multiplying this up when we start bringing on wave 2 later on this year, and certainly into the third year. We're going to have a huge volume of work that's being done. So wave 2 starts in April, so we'll be getting another 45 organisations coming and join us in the National Learning Set. And one of the things that we reflected on very quickly after the meeting this time last year was a lot of people who were going to be in wave 2 and wave 3 came to us very quickly and said, but we don't want to wait till next April, because there was a huge eagerness of wanting to get started. And so what we've done in the meantime over the last 12 months is started to work with these 3 sets of partner organisations, so with the patient safety collaboratives that are based within the academic health science networks, with our partners in the maternity clinical networks and those in the neonatal networks. And what we've started to do is have conversations about how we can establish some local support structures for those organisations not in the active waves, so as it would have been now, those in waves 2 and wave 3, but also as we go into this middle part of the year, the organisations here that have been in wave 1, they're going to need some ongoing support, because otherwise there is a danger that all the fantastic work that you've been doing will start to sort of settle a little bit as you feel a bit lonely. So what we've done is we've now, with the partnerships with those organisations, we've set up 21 local learning systems. And these are going to be where you as organisations will come together, and those 21 will wrap around the 44 local maternity systems. So we're trying to scaffold in some support across the country so that we've got the national learning sets and these local learning systems. And Phil, again, will talk a little bit more about the way that these will hopefully function and work. But for me, this is going to be the way that we cement this work into the future view of maternal and neonatal health, because once we've done the 3 national learning sets, we've got to have somewhere where this improvement work can continue. So this will become what I think will be the boiler room for the improvement work we'll be doing at system level. Now, alongside that, we were hoping, certainly when we started this time last year, that part of the diagnostic that all the Wave 1 organisations would do would be doing a safety culture assessment. And we haven't managed to get to do that as yet, and in fact it's mobilising at the moment, and the Wave 1 organisations are aware that we're going to be starting doing those safety culture assessments now. And then the plan is that we will also be doing the Wave 2 organisations during their diagnostic phase over the summer. So to allow that to happen, it's quite a logistic exercise, as I'm sure you can imagine, but we've now in the process of training up over 300 people to be able to do debriefing conversations, because some of you will get direct experience of this. In fact, 2/3 of the room will be getting direct experience of this year. Safety culture is a weird thing, so you spend a lot of time asking people questions about how they feel, but then the most important thing is asking them, is that representative of the organisations in which you work? And so the debriefing process is absolutely critical, because it isn't a report, it isn't a score that you can take back and mark an organisation as having a good or a poor safety culture. But it allows a much more open conversation and exploration about what are the local issues. And we're going to end up doing probably the largest safety culture assessment, certainly in a maternity service in England, and I think probably across one particular area of service that's ever been done before. So we're going to have a really granular understanding of what those issues are. And that, for me, again, is going to be absolutely critical, because we're going to be asking our colleagues to really become part of the problem-solving agenda for this. And that's going to allow us to have some very open and probably some quite candid conversations. But again, a very exciting opportunity. Now, sitting behind all of this, one of the key things that we wanted to do was to have some really tailored recipes for you. So I spoke last year and used a bit of a bake-off analogy about saying we're trying to give you an opportunity to look and attack a problem in a way that we can break it down into steps so that you'll be able to understand how you can approach it in a more methodical way. Because sometimes we talk about what we want to do, but we don't give you much guidance about how we should do it. So that's what we were trying to achieve. And to do that, we've brought together an advisory faculty that sits within the collaborative, and that advisory faculty's met 4 times. It's got 23 individuals in it, half of which have got really very high-level quality improvement expertise, and the other half are from a multidisciplinary set of specialties, so representing the Royal Colleges, the specialist societies. And what we've done with them is develop our driver diagram a little bit further, and so we've gone through about 7 iterations that I can think of at the moment, and it's an ongoing process. And what we've done is we've settled back into these 5 key clinical interventions. And one of the big things that we've learned in the last 12 months is we need to narrow our focus a little bit going forward. And so we're going to be pushing much more these big 5 clinical interventions, and these are the 5 that have been and will continue to focus on, because we're aware that there is a danger in improvement when you're doing it at national level, that you can get this sort of 1,000 flowers bloom issue. So you end up with lots of people feeling they want to do lots of different projects. But what we really, really want to be able to do is show some aggregated improvement in these 5 areas. And these 5 areas link very clearly through to the high-level harms that sit at the very top of the maternity transformation programme. And I think this is really important for 2 reasons. One, it will allow everyone to be working in a narrow area so we can start sharing our experiences and our improvements much more readily. So the amount of collaboration that you can generate will be much higher. But the second thing is it shows people outside of maternity and across the country that by doing this collectively, we really have made a significant difference on those high-level harms. So I think that's where this has got real advantage as well. And where we're doing is we're then drilling that down, and most people in the room who've worked with us this year will know that the key thing about quality improvement is being able to show measurable change. And so we've drilling down into, and we've now pretty much gone down to 9 key clinical outcomes that we'll be able to use to assess the improvement in those 5 work streams. So I'm hoping this time next year that we'll be showing you a real shift in those outcomes and how they link to all the work that you've been doing. And that's been something we've had to really think hard about over the last 12 months, because although we really want to encourage everyone to be doing work that's relevant to them, and I don't think the majority of things on those lists probably echo with most people in here. They'll think some of that really is pertinent to our own local environments. I think it's really important that we do keep the focus as narrow as we can to see that aggregated improvement. So, last thing I just wanted to touch on is trying to understand where we are. And one of the things that we've really struggled with in my own head is, and certainly before we went to Manchester, was getting a sense of where we were moving to from where we started this time last year. And that's actually quite difficult because it isn't something you can distill necessarily down into one particular number. And some of it will be relevant to the outcomes that we're measuring. But we wanted to get a sense of how can we look around the country with those 44 organisations and get some reflection about progress. And we started off with an extremely complex dashboard, and we were RAG rating everything from executive buy-in to data support. And then actually we had a chat with IHI and they threw this at us. And they have a 1 to 5 assessment scale, which kind of tells you and gives you an expectation about where you expect to be and where you actually are. And they do it numerically. It says it's only a 5-point scale, but actually it ends up being 10. You get half a point just by being in the room. So the Wave 2 organisations, before you've even started in April, the fact that you want to come and play, you get half a point for being here. And then the idea is at the end of the 3 years, what we want to be seeing is outstanding sustainable results across all our organisations to get to that 5. And so what we did is we've played around with this a little bit with the Wave 1 organisations. When they came to Manchester, we could have did a bit of an exercise. And I think as a programme, we were hoping by this time, we would be at about a 3. So we'd be seeing modest improvement across the organisations that we're working with. And I think the reality is we're probably sitting around a 2. But I think what we're going to see, and certainly my reflection again on the work that we've got around the room at the moment, is the acceleration in the improvement that we're going to see as we go into year 2 is going to be very impressive. So I suspect we will be seeing much greater improvement across the country in the next 12 months. And one of the things I think is really important to be thinking about as you're in the event today and networking is we've got really, really good evidence now that the way in which you work within a collaborative space, within a collaborative of this size, your level of improvement that you will see back in your own organisations is reflective on the degree with which you engage in these events and you engage in this process. So the more actively you engage, the more you're likely to take away with you, the greater the improvement that you will see back at your own organisation is. But in addition, the more actively you engage in the collaborative, the greater the improvement you will see across the whole of that collaborative by your participation. And similarly, the reverse is true. So if you come in with a competitive, combative frame point, that you're just going to come in and suck all of the improvement out, you end up doing worse, and everyone together does worse. So this is about creating this sort of type of social movement. And so that active engagement will propel us all a lot further forward. And I say part of it is about reflecting on where you are personally, but just wanted to sort of say one of the things I've really noticed over the last 12 months is how actively people want to get involved in this process. And we've been to some of the local learning system events over the last few months since they've started up. And again, listening to the way that people are coming together in smaller groups. I was at the event down in Wessex week before last. And what was so interesting to me was listening to people from the Wave 1 organisations talking about improvement so freely with their colleagues who were going to be coming in Wave 2 and Wave 3, but using language that I wasn't anticipating they would feel so comfortable using 12 months down the line. So I think there is this real shift in the way that we're starting to approach these problems. We aren't falling back on old tropes. We're actually starting to think about things. And there was a brilliant way, one of the midwives was talking about a project they were trying to introduce, and she works in a Wave 1 organisation, and some of her colleagues said, well, we can't introduce that because we haven't tested it yet. And you suddenly started to think people are starting to be influenced all the way down the line by the way that we're thinking. And that type of shift is so key to this really moving forward. And I think the reason being, because actually what we mustn't lose sight of is why we're here. So it's nice to get together, it's nice to drink coffee and talk and congratulate yourselves on the work that you're doing, and I have really enjoyed getting to know a lot of the people in the Wave 1 organisations. But we are here for one singular aim, and that is this. And that's what we started talking about a year ago, and this is very much what we must be focused on going forward. And I genuinely believe if we carry on and do what we've done this year, last year, this year, and the year after, that actually in a couple of years' time we'll be standing on this stage again and talking about this, because we will have actually achieved it, not just be an aim. So those are my reflections on this year. I hope you enjoy the rest of your day. I'm happy to take a couple of questions if you want now, and thank you very much.